What are the common types of trauma to the brain? I'm Joe Lamb, and today on Joe Knows Brains, we're going to go over kind of the common sources and types of trauma that can cause brain injuries. Last time when I was talking a little bit about concussions mainly, people asked, well, what are the other types of brain injuries? This is the presentation where we get to go over all the gruesome damage that brains can go through outside of just kind of the shearing forces common in concussions. But that's where I'm going to start off. The first type of trauma to the brain, I'll go ahead and say we're going to go over three main types of trauma. The first is going to be diffuse axonal injuries, big fancy word for saying that the cells get stretched when the brain gets shook. The second is lacerations, which is a big fancy word for cuts. And the third is blood clots or hematomas. I already gave you the fancy name for that one. So the first type of injury, this is the most common, the one we see in my practice the most. These are diffuse axonal injuries, also known as axonal shearing. All of that's big fancy science words to basically sum up what I was talking about in my last video, which is the brain is like a bunch of pickles inside a jar. And when you shake that jar, it goes sloshing around right next to everything. And when that happens, when it's getting moved around so quickly, it causes the brain to kind of be morphed. Like think of it as like a sponge, and it can be squeezed and it can be expanded. And when that happens, all of the axons, the brain cells that make up the brain, their little tails get pulled apart. And when that happens, it damages them. Kind of a simple process. If you think about a string and you pull it 50 times, it's not going to be as strong the next time. This type of injury is the most common, as I mentioned, in concussions. And really what it is that once the axons are sheared or stretched, the inflammation can cause cell death, can cause memory loss, can cause a lot of different types of brain difficulties going forward. And I've talked about those in some of my other videos. The second main type of brain injuries is a laceration. And again, a laceration is a big fancy word for a cut. Lacerations are probably the rarest type of brain injury. They're seen most often in really traumatic accidents. A good example of laceration is being shot in the head, because the bullet itself is going to physically cut through the brain tissue. If someone has a skull fracture, oftentimes an X-ray is done in order to investigate if any of the bony fragments have cut any of the blood vessels in the brain. Kind of a morbid topic for it, but it's a very common type of brain injury. It's a very serious type of brain injury. Not one that I see in my practice. I think a criminal lawyer may see things like that a little bit more often than I do. But anytime that the brain's stabbed, shot, punctured, you scratch, you can't really scratch the front of your head. This is what we're talking about, because that's what the skull is there for. But anytime something punctures the skull and the brain takes direct damage, that's going to be a laceration. And then the third main type is blood clots. Kind of similar to lacerations in that, obviously blood loss is an integral part of the entire process. But what happens a lot of times, and, I think all of us are familiar with heart attacks and strokes, those are both examples of blood clots gone bad. In a heart attack, it's when, the arteries around your heart get clogged by plaque, people with high blood pressure. And it leads to the heart essentially not being able to do its job because the vessels are so clogged. Stroke is a very similar situation in the brain. You get one of the arteries clogged that provides the blood to the brain, which of course provides the oxygen the brain needs to perform its functions. And all of a sudden, then the brain stops working, and it's an emergency medical condition, and they're rushed to the hospital. I do see type situations like that in my practice a good bit of stroke patients where they're one moment they're fine, and the next moment their brain just simply isn't working. There's three main types of blood clots. They're common in the medical field. They're called hematomas. The first is known as an epidural or an extradural hematoma. This is when the blood accumulates between the skull and what's known as the dura. The dura is the outer layer of the brain. So this is really, if you think about it, there's different levels and layers that we're going to talk about within the brain and with these types of injuries. So this first one, it's the highest layer. I mean, the highest layer would actually be if you just had a bruise on your head, then you've got a hematoma that's just blood clot above it. We've all had that. You bang your head, you get a little bump. It's a blood clot. It's a bruise for most of us. But when that bruise is between the skull and the brain, it's a lot more serious condition. That can create pressure on the brain. That can lead to loss of oxygen in other areas of the brain. It can result in diminished brain function. It's most commonly associated with very, very severe headaches. That's what causes most people to come in when they discover that they have one of these hematomas. And again, the first one's an epidural or, hey, thank you, Katie, or extradural hematoma. The second one's an intracranial hematoma. This is very similar, but a little bit different, which means nothing. When a blood vessel ruptures between the skull and the brain, but more inside the brain, inside of the actual membrane or the dura, this is an intracranial hematoma. Very similar effects, very similar situation. I think most people, when they think of hematomas, those that think of hematomas, are familiar with the subdural hematoma. And these are actually the most dangerous form of hematoma. This occurs when the blood collects between the dura and the actual arachnoid layer of the brain. And really, that's just a fancy way of saying essentially within the brain matter itself. And that means that these can occur anywhere along the area. And when they occur, they can cut off blood flow. They can prevent certain areas of the brain from functioning. And they can really cause a lot of pressure in the head, which again is what causes most people to be aware of these. This is probably the most common and serious type of hematoma that occurs in auto accidents. Now, to tell you the truth, the difference between all these different hematomas is less important than if you've got a blood pool in the brain, whether it's between the brain and the skull, within the brain. Heck, you've got a nice knot on your head. It's definitely a medical condition you're going to want to see a doctor for, because as I've talked about before, the science continues to prove that brain injuries are very serious injuries and ones that require prompt medical attention and to be taken seriously. And so whether you've suffered, but whether you've suffered a concussion, whether you've got any other kind of brain issue going on, God forbid, if you're ever shot, I highly recommend going to the hospital afterwards. Make sure to get it checked out by a doctor. I always highly, highly recommend it. And if you find these types of things interesting, like I do, all this information's in our book, A Layman's Guide to Brain Injuries. A layman is just a fancy word of saying you and I, an average Joe. It's a pretty simple book. It does a great job of taking these concepts and making them in language that you and I can understand. And our link's going to be posted there. It is right below. So anybody who's interested in getting this book, come check it out. We'd love to have you guys have the opportunity to learn more about it, whether you're interested or whether you're trying to learn about brain injuries for whatever reason you so choose. So thank you guys so much for your time today. Really hope you guys found this video informative and helpful, and wish everybody the best. Thank you.